Well, joining me now to discuss North Korea, its provocations, and the resurrected, it appears, about to be resurrected, health care legislation, Congressman Mo Brooks of Alabama. He's a member of the House Freedom Caucus and a number of key committees, including the House Armed Services and Foreign Affairs committees. Great to have you with us, Congressman.
My pleasure.
Well, this is a highly unusual meeting. The leadership of the House is not there, Speaker Ryan. Why not?
I can't explain why Paul Ryan is not a part of these meetings. It might be that he's got other commitments. It might be that there's some resistance with some group. I don't know who would resist Paul Ryan participating in these meetings. But the fact is, in the meetings I've participated in, say with the Vice President, Paul Ryan has not been present.
Yeah. And are you hopeful that something will come of this meeting? Is there a foundation for it? I mean, you guys have been laboring. And when I say you guys, that's my inartful way of saying the Republican conference have been laboring under this better way mantra that somehow the speaker describes his agenda when it's the president's agenda most Americans really want to see implemented. Is that an essential conflict in what's going on here in the House?
Well, I don't know if it's a conflict or not, but I will say this. We have an excellent relationship with Mike Pence. I served with Mike Pence when I was first elected. In fact, tried to convince him to run for presidency in 2012 before we started seeing a crowded field. And the House Freedom Caucus members, by and large, we love working with Mike Pence, and we're on the same wavelength. There are a couple major issues with the health care bill, one of which is the Congressional Budget Office report that if we leave it as it is, that it's going to increase health insurance premiums for American citizens overall in the neighborhood of 15 to 20% over the next 2 or 3 years, over and above Obamacare. And so what Vice President Pence and I and some other House Freedom Caucus members are working on is what can we do to force these health care costs to go down, and with that, the premium cost to go down so that struggling American families can better make ends meet.
Well, the Vice President
and I had a candid discussion about that last night.
Well, I mean, that's terrific, and that's hopeful. But the president's made it clear. Get insurance companies involved, engaged, and let them do business in any state, anywhere in the country, and let them sell insurance. That would be a helpful doggone thing, wouldn't it?
It absolutely would be, to force competition into the healthcare industry and interstate competition of health insurance providers. So
why wasn't that a hallmark of Speaker Ryan's bill?
That's a good question. I believe it should be in this legislation. Antitrust exemptions, we need to deal with that so that there's competition rather than monopolies or oligopolies. We should deal with that, and it should be in this legislation too. But with respect to the premiums, Vice President Pence, he has offered an arrangement whereby states that want to opt out of some of these more costly insurance mandates can make a request to the executive branch, and the executive branch, we've been told, will view those relatively favorably. I'd like to take it a step further. Hopefully we'll go that way, where the states don't have to come with hat in hand on bended knee, and they can just declare to the federal government that they're opting out as a matter of states' rights. And I've explained to Vice President Pence, if he'll make it a matter of states' rights, where we don't have to come to this administration, which I think will get good reviews, but later administrations we might not be so well received. If we have it as a matter of statute that it is a states' rights issue, then I'm in.
Block grants to the states. So there sounds like there's been enough talk that we're talking about a handful of items. It does not make any sense to me that these handful of items shouldn't have already been discussed with the president and his administration before there was ever a vote taken. I know you don't want to talk about the speaker, and frankly, I don't either, because I think he has done a horrible job of leading the House on this legislation, and his absence is one of the most hopeful aspects, I think, of what you guys have got going tonight. Congressman, there's so much we could always talk about. I appreciate you sharing your thoughts, and hope we can get this country moving with appropriate legislation in the repeal and replace of Obamacare, certainly.